Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal video today. We've got two patients in this video. So first patient's come through, you can see looking very blocked up. Some softer, squishier types of wax are on the left hand side there and some slightly harder bits as well. So we're using the standard size Zollner tube just to get a grip on this outside edge. You can see where it's hardened around the right side. Look, there's a little bit of softer wax. The little triangle in the centre is a little bit softer than the rest. So we're just going to try and break that away first of all. You can see it's quite thick and a little bit hardened up. There's a few hairs embedded in there as well, which is helping to bind everything together slightly. So just trying to get a grip on the top section, bring that down and try and unstick as best we can from the canal walls at the moment. But you can see it's quite a large lump. And you can see all the little bits of hair just starting to come away from the inner section of the wax there. So lots of little ear hair trims going on in there. It's just all embedding together. So this is the Jobson horn now. So we're just going to go in with this one. It's quite thick. It's not really budging with the Zollner tube. So we're just trying to get a grip above the wax now. Pull down into it. You can see it's stretching more than kind of pulling out of the canal. You can see it just folded that top front section there. So it's gone flat now to the bottom of the canal. So we'll just get rid of that piece first. You can see where the Jobson's just kind of pulled down into this section. So we're aiming to try and find a harder section a bit further in if we can, which will allow us to get a good grip to be able to take this out in a larger piece. But you can see it just folds it forwards rather than pulls from further in. So we're just going to tidy up around the edge here, aim a little bit deeper. Trying to get a good bit of purchase on the central section of wax to try and bring the whole section out. Because the outer section is quite hardened up, you see it, that's why it's folding and flattening at the bottom of the canal. So I'm just trying to lift off this right canal wall, just work down the side of the wax, and I work down the top right corner. Just trying to get a little bit of movement to this wax. You can see not going particularly deep, but just enough to get a grip on the harder outer section to slide the wax forwards. Now we can go behind it then and get to the next section behind that as well. You can see just pulling on that hard bottom section. I'm going to work around this top and to the left hand side a little bit now. There you go, taking that section away. You can see it's all still just folding forwards. Back in again now, trying to get behind that top section again. There we are, rolling. That is starting to move now. We can see it rolling out. There we go. So you can see it's quite a hair-filled lump there. We've got a couple of little stray hairs and this little bit of dry wax to the left-hand side. So we'll just go and grab that now. We'll use the suction tube to take that away. Here we are. So just lifting. There we go. Out he pops. Here's the eardrum there, little tiny flakes of dry skin left and right. So you can see this was one large mass of hair and dried wax, that kind of reddish brown colour to it, which you get quite a bit with the thicker hardened up edges of wax. So you can see this patient has what on first glance appears to be quite hard, dense wax at the entrance to the canal here, a little bit of dry skin. This gentleman does suffer with some dry skin in the ear canals, which does tend to dry the wax out a little bit. And sometimes what you get is a very dry outer section of wax and then a very soft core. So because the outside dries a lot quicker than the central section. So we're just working on this large piece at the entrance to the canal. See, there's a little gap there at the top, so you know what's coming. We're going to use the St. Bart's hook there just to see. Now what happens when we push into it? Can you see what I was saying about this harder outer section, but a very, very soft, squishy middle section to the wax? And what you'll see what happens when we push the Jobson horn is as we turn, it doesn't get a grip on the wax. You can see it pulled through that outer section. So we're better off with the Jobson horn here. I think we're just going to use a mixture of tools on this one. Because of the shape of the Jobson horn and that circular round end to it. It just means that you do tend to get a better grip on this type of wax, this more thicker, softer cord wax here. So just tidying up a little bit. So we're using the suction tube to pull the outer edges of wax into the center, which is the harder parts, and then we can use the Jobson horn then to take away some of the softer bits, which wouldn't be quite as appropriate for use with the suction tube, just because that very thick soft section would block the end of the tube really quickly, so you'd have to be kind of really flushing this out quite a bit. But you can see we've got a good grip on our harder piece here, so we're going to use the suction as much as we can to remove this harder section. Just trying to kind of battle with it really at the entrance a moment, just to trying to get a good enough grip on it to hold it, to kind of wiggle it away from the canal walls. But where it's dried and the skin underneath is quite dry, and sometimes the wax can actually stick to the canal wall really firmly, which is what's happening here. So although we're getting a good grip with the suction, it's not really kind of budging too much. You can see we're sort of wiggling this around, but it's really firmly attached further in. So I'm just trying to push into the wax now to try and get a good grip. As I was saying earlier, that softer wax in the center would block the suction. Well, what it can do, as we've done there, is if you push into it, it'll hold into that suction really firmly. So it just means then you can get a better sort of grip in the center that will hold a little bit more tightly. So we've popped a little bit of olive oil in here just because we can see it's quite firmly attached to this canal wall. We've got this kind of softer section, so I'm hoping if we can oil around the outside edge and work a little bit of oil down the sides, it's going to help this to peel away and come away a little bit more effectively from the canal walls. You can see just working around the outside edge, you can see it lifting and pulling away from the canal wall. There we go. Now we're starting to see a little bit of movement to the top. There we are. A little bit of a wiggle. The olive oil's done its job. It's lubricated the canal wall, worked its way down the side. We're going to have to sort of maneuver this and just reposition it to get it out to the canal. You can see it doesn't want to budge. Much darker, harder section. There we go. There we go. Out it pops. You can see the bits of dry skin, that whiter coloured material on the outside edge. And there we are. There's the eardrum. So this is the patient, same patient, but the second ear now. A little bit blurry there. Just a couple of little hairs on the outer part of the ear canal, which is altering the endoscope's focus a little bit. You can see we've got a little gap down the front end, a little bit stuck to this, mainly stuck to this right canal wall, and as it goes further into the left canal wall then. So we're just going to oil to start with on this one because we can see it's quite firmly attached in there, and we're hoping if I can get a good enough grip and lift into that gap in the top left hand corner, then we might get enough movement to the wax that we can slide this out in one go. So you can see, because like the other side was quite firmly attached to the outer part of the ear canal, this one not so much, and we have got some wiggle room, for want of a better word, really in there. So it just means we can really maneuver this wax and try and sort of gently tease it out while we're holding on to it. You can see using the same trick there, pushing it into the wax to get a good grip on that softer core of the wax, to try and take that out as well. Broken the front section away. Now not so much wiggle room now for this deeper section. You can see it's not a great deal of gap at the top there. What I was hoping was going to happen is if we held onto the front section, it would have pulled this deeper section forwards, which would have given us a little bit more room. There we are. Now it's starting to move. There we go. You can see the dry skin, quite a long piece of wax, that one. So we've got some tidying up to do in here as well, because we can see there's some bits broken off a bit further in. Just aiming for the top section of wax there so we can peel down. There we go. You can see it starting to peel away from the canal wall. There we are. You can see how firmly attached that was as well. What I was saying earlier about that the dry skin, if you're not producing a lot of oil in the canals, the outer section of wax will dry quite effectively against the canal wall. So you can see it's really stuck. There we are. To peel along the edge there. Fine end going to go in now, so we need to work into this top right corner. And it's going to be a case of gripping the outside, pulling down to peel down, which is going to expose a flatter part of the wax, then peel down again, aim for that top section of wax again, You can see it's just a very slow process of peeling, maneuvering the wax, peeling again, maneuvering, peeling. So it's just kind of going back and forth with it. Very slowly. You can see just aiming for this top section. They're just pulling down, just pulling off the eardrum now, off the right canal wall. There we are. So that's come away. I've got a section here at the top, just above the hammer bone. So we're just aiming just at the edge of it. There we go, just peeling that away. You can see the dry skin just detaching underneath. Okay, there's a section here to the left hand canal wall, which is going to prove a little bit difficult to get. So we just need to get this off the canal wall first. So we're just going to aim. There we are. Get a good peel to this. You can see where it's quite firmly stuck. Just peeling behind that lump. There we are. Lovely. Now we attempted this section at the top left hand corner, which is a really difficult place to get into, and it's quite uncomfortable here to remove this section. So you're very much dependent on the patient tolerating this to have this taken away. I forget to speak. Sorry, very gently pulling this away from the top. There you go, just coming away now. You can see a little bit of movement from the patient there, finding it just a little bit uncomfortable, but happy enough to carry on. See how difficult it is to get into that section. There we are. I've taken that top section away. It's cleared the eardrum. There you go, you can see the eardrum there. Patient's happy enough with that. So this is what we removed. So you can see quite large chunks in here, very different colours as well. We're going from very light to very dark wax. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already and you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.